In Ohio, you accepted Medicaid expansion, and you took on the health care exchanges, and it was to help the poor. Here in Wisconsin, Governor Walker used Badger Care to essentially provide the same services at the same levels, and yet we did it without creating a whole new entitlement program and expanding the federal debt. Why did you choose Obamacare? Why did you choose the Washington-based solution? And why can't you guys ever look at some other source other than Washington for these solutions?
Okay, let me say a couple things. First of all, it's not so simple what Governor Walker did here. And if you look at it, it's more complicated. And by the way, today, the Milwaukee Journal-Sentinel endorsed me for President of the United States, saying I'm the guy that is a pragmatic conservative that can get things done. I was really appreciative of that endorsement. But look, I took a Medicaid program that was growing at 10.5%. And in my second year as governor, it grew at 2.5% without taking one person off the rolls or cutting one benefit. How did I do it? I brought innovation to the system. Now, I then had a choice. Now that my program was under control, I then had a choice. Could I bring money back, which is frankly our money, Ohio money, back to Ohio to solve some of our problems? And let me tell you what we've done. I don't believe the mentally ill ought to be sleeping under a bridge or living in prison. It costs $22,500 a year to put them in prison. If I can get their medication and get them on their feet, and if they can get a job, they become taxpayers. We save money. Secondly, I believe that the drug addicted in our prisons should be treated, because we don't want a revolving door of in and out of the prisons, because that costs $22,500 a year, and we also are throwing a life down the drain. So guess what? Because of our program now in the prisons and with the community, we have an 80% success rate in not having people go back in, and our recidivism rate is 27%. And by the way, we're running a $2 billion surplus. We don't put our budget together with scotch tape and baling wire. We're running a $2 billion surplus. We're managing it all. So where are we? Where we are in Ohio is we are now treating the mentally ill, the drug addicted, the working poor. They're in a better position. They're not in our prisons. And at the same time, they're getting on their feet. They're becoming taxpayers, and our Medicaid program is completely under control. And by the way, I reject Obamacare, and I did not go along with this exchange that they were trying to force on me, because I never knew what the heck was going to come of it. I actually have a solid health care plan to replace Obamacare, which involves transparency, competition, market-oriented forces. We're actually doing it in my state, and I like to spread it all across the country. So the idea of doing that was not only compassionate, but it also made good economic sense for our state, and it's working out quite well.
Thank you for your question. Governor, I want you to meet. This is Julie Grace. She's a student at Marquette University.
Just one other thing I want to say. Do you understand that I spent 10 years of my life fighting to balance the budget? And we got it balanced. Senator Domenici and I worked with the Clinton administration. We got the budget balanced 4 years in a row. It hadn't been balanced since man walked on the moon. Hasn't been balanced since. And when I left Washington, there was a $5 trillion surplus. And guess who spent it? The Republicans. Now, sir, you have to stand in the breach when you're a leader. And what I did in Washington in getting that budget under control and seeing it lift off in jobs, and what I've done in Ohio, we're now up 417,000 jobs in Ohio from a downturn of when I came in of 350,000. And we've cut taxes by more than any governor in the country, including your governor.
All right. I want you to meet Julie Grace. She's a student at Marquette University.